Even the slightest thought of losing a beloved furry friend is heartbreaking, and it's natural to want to be as informed as possible during those difficult moments. In this video, we will discuss how to know if your dog is dying, and what signs to look out for when you have just one day left with your precious companion. Before we begin, make sure you like and subscribe if you want your dog to live 100 years. I definitely want my dog to live 100 years. We will be discussing some major 5 symptoms that can be a real threat, but also make sure to refer to the proper veterinary doctors before coming to any conclusions. The first and major symptom can be a lack of interest in going out and indulging in physical activities. A change in behavior and activities can sometimes signal the underlying health issues. Dogs, like humans, can experience shift in behavior due to various factors, including physical discomfort, emotional distress, or changes in their environment. One of the key indicators that a dog may be facing health challenges is a noticeable shift in its behavior patterns. Lethargy, a common manifestation of behavioral change, often prompts concern among pet owners. If a dog that was once lively and energetic becomes persistently lethargic, it may suggest an underlying health issue. Dogs are social animals, and a sudden reluctance to engage with family members, play with toys, or partake in routine activities could signal emotional distress or even physical discomfort. This change may not be a direct precursor to death, but may necessitate careful observation and veterinary intervention to determine the root cause. If a dog fails to react to its owner's voice, the sound of a favorite toy, or other previously engaging stimuli, it may suggest sensory or neurological issues. This can be indicative of various conditions, from hearing loss to more serious neurological disorders. While behavioral changes can be distressing, it's crucial to approach the situation with a proactive mindset. Veterinary consultation is important when significant shifts in behavior occur. A thorough examination can help in identifying the underlying cause, whether it be a treatable medical condition, pain management needs, or adjustments in the dog's environment to alleviate stress. The second symptom is loss of appetite and weight loss. A sudden and severe loss of appetite accompanied by significant weight loss in a dog is a distressing symptom that demands immediate attention from pet owners. Dogs are known for their hearty appetites, and any deviation from their usual eating habits can be indicative of underlying health issues, some of which can be serious and potentially life-threatening. A dog's reluctance to eat can be caused by a myriad of factors, ranging from temporary stress to chronic medical conditions. However, when this behavior is coupled with rapid and drastic weight loss, it raises significant concerns about the dog's overall health and well-being. The underlying causes of this phenomenon can be varied and complex. While temporary factors, such as changes in diet or environmental stressors, can contribute to a short-term decrease in appetite, prolonged refusal to eat and substantial weight loss suggests an underlying health problem that requires a thorough investigation. Organ failure, cancer, infectious diseases, dental issues, or metabolic disorders are all among the potential causes of a dog's loss of appetite and weight loss. In some cases, gastrointestinal problems, such as obstruction or inflammatory conditions, may also play a role. Rapid weight loss can lead to muscle wasting and a weakened immune system, making the dog more susceptible to infections and further complications. It also has the potential to exacerbate existing health issues, creating a cycle of declining health. While weight loss and loss of appetite are alarming symptoms, it is crucial for pet owners to approach the situation with a proactive mindset, rather than jumping to conclusions about the dog's imminent death. The third symptom is the dog showing altered vital signs. When a dog begins to exhibit altered vital signs, it serves as a critical indicator that something may be amiss with their health, signaling potential proximity to the end of their life. Vital signs include heart rate, respiratory rate, and body temperature, and they're all fundamental parameters that offer insights into a dog's overall well-being. One of the primary vital signs affected is the heart rate. A dog's heartbeat is a reliable metric for assessing cardiovascular health. In the context of a dog approaching the end of its life, a notable alteration in heart rate may be observed. Typically, a dog's heart rate ranges between 60 to 140 beats per minute, depending on factors such as size, breed, and age. Respiratory rate is another vital sign that undergoes changes as the dog nears the end of its life. Normal respiratory rates from dogs range from 10 to 30 breaths per minute. An increase in respiratory rate, known as tachypnea, may be linked to various conditions, such as respiratory distress, heart failure, or pain. Body temperature fluctuations also contribute to the overall assessment of a dog's health. The decline may be associated with a decrease in metabolic activity and organ function. Monitoring body temperature becomes crucial in recognizing the progression of severe illness or organ failure. When a dog is nearing the end of its life, these altered vital signs collectively paint a poignant picture of their declining health. While these signs may be distressing to witness, they offer an opportunity for pet owners to provide comfort and palliative care, and potentially make decisions regarding end-of-life care with the guidance of a veterinarian. The fourth symptom is the loss of consciousness or seizures. The sudden onset of loss of consciousness or seizures in a dog is a grave and alarming symptom that necessitates immediate veterinary attention. Dogs, like humans, can experience seizures, which are involuntary and uncontrolled electrical disturbances in the brain. The causes of seizures in dogs are diverse and can include neurological disorders, epilepsy, toxic exposures, metabolic imbalances, or underlying health conditions affecting the brain. Dogs experiencing seizures may thrash uncontrollably, putting themselves at risk of trauma. It is crucial for pet owners to take precautions during a seizure, such as moving nearby objects that could cause harm and avoiding direct contact with the dog's mouth to prevent accidental bites. If a dog experiences multiple seizures within a short period, known as cluster seizures, or if a seizure lasts for an extended duration, it is a medical emergency. Continuous or clustered seizures can lead to a condition called status epilepticus, which is a prolonged and life-threatening seizure state requiring immediate veterinary attention. It's essential for pet owners to provide the veterinarian with detailed information about the dog's medical history, recent exposures, and the observed characteristics of the seizures. This information aids in diagnosing the specific cause and tailoring the treatment approach to the individual dog's needs. Many dogs with seizure disorders can lead fulfilling lives with proper management and treatment. Timely veterinary intervention not only addresses the acute episode, but also helps in managing the underlying condition, improving the dog's overall quality of life. In some cases, toxins or ingested substances can trigger seizures, further emphasizing the importance of identifying the root cause through diagnostic evaluation. The fifth symptom is uncontrollable bleeding or hemorrhage. The sight of uncontrolled bleeding or hemorrhage in a dog is a distressing and potentially life-threatening situation that demands immediate veterinary attention. Dogs, like any living beings, can experience injuries or conditions leading to bleeding. Uncontrolled bleeding can result from various causes, including trauma, lacerations, ingesting toxic substances, or underlying medical conditions affecting the blood clotting process. Regardless of the cause, when a dog experiences excessive bleeding, it poses a significant risk to its health and may lead to shock, organ failure, or even death if not promptly addressed. One common cause of uncontrollable bleeding is trauma, which can result from accidents, bites, or falls. External injuries like cuts, abrasions, or puncture wounds can cause bleeding that may be visible to the naked eye. Another potential cause of bleeding in dogs is ingestion of toxic substances. Some toxins, such as rat poison or certain medications, can interfere with the blood's ability to clot, leading to uncontrolled bleeding. The severity of bleeding can vary, ranging from minor wounds that result in slow oozing to profuse bleeding that is rapid and uncontrollable. Treatment options will depend on the cause of the bleeding and may include suturing wounds, administer clotting agents, or addressing underlying medical conditions. It's important for pet owners to avoid attempting extensive first aid measures at home, especially if they are unsure about the cause of bleeding. Applying excessive force or using inappropriate materials may cause some additional harm. Preventing access to potentially toxic substances and creating a safe environment for dogs can reduce the risk of bleeding due to the ingestion of harmful materials. The sixth symptom is pale gums or tongue. This is a critical indicator of a dog's health status. The color of a dog's gums and tongue are a key parameter in reflecting the adequacy of oxygen in their blood and overall circulatory health. Normally, a healthy dog exhibits pink, moist gums and a pink tongue. However, pale or discolored gums could signify a diminished blood supply and reduced oxygen levels, which are definitely alarming signs. Paleness in the gums and tongue might result from conditions such as anemia, shock, internal bleeding, or cardiovascular problems. Anemia, characterized by a low red blood cell count, can reduce the blood's oxygen carrying capacity, leading to paleness. Shock, whether due to trauma, severe infection, or other critical conditions, can compromise blood flow and cause paleness. Internal bleeding, often unseen externally, can result in a gradual loss of blood, leading to a pale mucous membrane. Cardiovascular issues, including heart failure or severe heart disease, may reduce the heart's ability to pump blood effectively, resulting in inadequate oxygenation. Recognizing pale gums or tongues prompts immediate veterinary attention, as it indicates a potentially life-threatening situation requiring swift diagnosis and intervention. Monitoring and addressing circulatory health are crucial aspects of ensuring a dog's overall well-being. Our hearts go out to all those who are facing the difficult possibility of saying goodbye to their canine companions. Cherish the time that you have left, make it special, and surround your fur baby with love and comfort. We'll see you all with another video soon. Now, I know you love your dog so much, but do you know that your dog might not like you? Don't miss this video to find out 5 signs that your dog hates you.